Healthcare workers have expressed their concern over the effects of a collapsing system in the provision of holistic and quality services to young people. Let's discuss this further. We're joined this afternoon by the General Secretary of a trade union called the Health and Allied Workers Indaba Trade Union. Lerato Mthunzi joins us this afternoon. Lerato, it's great to see you. Thanks very much indeed for coming onto the program. Access to healthcare as something that has been forgotten in Youth Month. It's not just about unemployment, isn't it? It's about the impact on various spheres of the lives of young people as a result of unemployment, just as one example.
Most definitely. But maybe first, let me greet all the viewers and yourselves. You're right. I think the youth of South Africa is totally forgotten. Everyone is so focused on who is going to be occupying the top rows of government. And in this month, we're not just dealing with unemployment, we're not dealing with social ills, we're dealing with even issues of mental health. All those things that are really stemming and flowing directly from the fact that we've ignored the fact that our youth is so heavily impacted. We've got the highest numbers in our country of youth that is dealing with drug abuse, issues of depression, anxiety, and just to mention a few. And I think we're not highlighting and we're not coming with a tangible, and we are not being intentional about getting to the solutions.
And what would that look like for you? When we struggle with basic things insofar as the provision of healthcare services and healthcare infrastructure, Lerato, how do we move the needle on this?
No, the biggest challenge is that we know that our youth is the majority of our citizens in the country, and these are the people that we are hoping that they will turn the wheels of our economy and move our country into the right direction. And those are really the leaders of tomorrow. And if we do not invest in them, you can only imagine how bleak the future looks. So to be honest, I think this is something that it should not even be a negotiable. It should be something that we intentionally are able to do. Our mental health starts really at low, higher, and all stratas of education where we are able to intervene accordingly. And I think, our government, just that big intervention of creating employment will alleviate mental health care issues of those who are suffering from serious issues of depression and so forth. Because all I want as a graduate is really to start my life as a young adult and be able to get to that job and be impactful in my family and obviously in my society. And if we can deal with that alone without even thinking curative, or we thinking about how we're going to deal with them when they are highly on drugs. But the primary issue of dealing with what are the core problems, and the first one, of course, is unemployment and being able to give our youth a purpose for actually living.
Yeah, and all our young people want is to be able to be hopeful for the future, right?
Absolutely. I think our young people are not asking for much. They're not asking for those cabinet positions. They're not asking for a lot of tenders. They're just asking to say, can we get free education? I think that's at the basic. Can we get free education? And once we've got that free education, can we be allowed to contribute meaningfully in our society? And if we nail this too as low-lying fruits, I don't see us as a society going or going astray.
Lerato, there's a report, UNICEF South Africa report, a poll released. The numbers, I'm sure, are outdated. They might even be worse than this 2021 report. But back then, the report said that 65% of young people stated that they had some form of a mental health issue, but that they did not seek help. Do our young people even know, just generally speaking, where to go when they do need help?
I think my answer was going to be, if you're a young person and you need help, really, where do you go? Because the current psychiatric system that we have in the country is mainly curative. We don't have anything that prevents the very depression, the very mental illness to actually occur, which are the things that I've mentioned earlier on. We are mostly focused to say when that elastic has snapped, how do we deal with it? And we're taking you to a hospital that observes you for 72 hours, probably keep you for a long stay in a mental institution, and without any form of resources that really is able to even rehabilitate you back and integrate you back into society. So it's a vicious cycle where you find that the very same patients that you nursed last year are back in your wards yet again because the core, the actual root cause is not being dealt with. So really, where do they go? I mean, support groups, everything needs money. That is why we're advocating for NHI, and we're saying, look, let this NHI come, let it be something that everybody is put in this dirty dustbin. We all find our way out, and together we can help each other if, you know, the whole lot of people are there. Currently, if you can't at least afford to go to a private mental institution, it's really bad for you.
And that's not even to mention the issue of reproductive rights and information around reproductive health, right? Is that as accessible as it absolutely should be in 2024?
I mean, we still have clinics, we still have got healthcare workers that will be so anal about why did you come late at the clinic? And I think by that time, you know, I'm a big advocate for healthcare workers, but by the time you come in after work or after school or whatever, the EPWP program that you are doing, where you are able to get that little bit of 350 or 3.5 as a minimum wage, the nurses are exhausted. They've been in a position where they've got to see more than 200, 300 patients, and there's no more smile in their face. It's almost knock-off time, and they are really bent out to the core.
Yeah, absolutely. It paints a picture, doesn't it, Lerato, of perhaps a government that is not attuned to the kinds of needs of particularly young people who make up the majority of our country.
Look, I mean, young people adopt keyboard activists, and young people are not seen as being, you know, very apathetic or when it comes to being involved in politics. But to be very honest, does the government of the day expect another 1976 youth uprising so that they can actually listen? Do we need to go the route that other neighboring countries in Africa are actually currently doing for our government to actually sit and listen? I don't think that is necessary. We should be able this time around choose correct people to put in the helm of our government so that they're able to prioritize the needs of all, you know, of all people, but mainly those ones who are at the verge of being the wheels that are able to make the wheels of our economy turn. Yeah. And that is definitely the youth.
The future of the country. Lerato Mthunzi, let me thank you for your time this afternoon. She's the General Secretary of the Health and Allied Workers Indaba Trade Union.